Hello class, my name is Juan Castillo and today I will be discussing the Food and Nutrition Service and the National Institute of Food and Agriculture. I would like to note that throughout the presentation, I'll be referring to the Food and Nutrition Service as the FNS and the National Institute of Food and Agriculture as NIFA. A quick overview of what I'll be discussing today is the history of NIFA and FNS, and understand what NIFA and FNS are and how they function. Then we'll look at the nutritional programs FNS and NIFA have to offer, explain who NIFA and FNS service and the eligibility requirements for FNS programs. Then we'll discuss what currently is happening within NIFA and FNS. And to conclude it, we'll look at the roles of the dietitian in NIFA and FNS. Starting off with the history of the Food and Nutrition Service, its origin dates back to 1953 and it was originally named the Food and Consumer Service, also known as the FCS. The agency was used to house together all of the food assistance programs under one branch. What is interesting to note about this is that prior to 1953, there were already food assistance programs such as SNAP and the National School Lunch Program due to the Great Depression, which left many Americans hungry. The agency was re-established in 1969 and was officially a part of the USDA. As a part of the USDA, the programs were able to become more organized on a nationwide level and assist Americans on a more frequent basis. In 1969, there was an estimated 15 million Americans facing food insecurity. In 2018, 4.3 million American households were facing food insecurity. This shows that food insecurity has remained a prevalent issue in the United States. In 1970, a year after the program was established with the USDA, the Food and Nutrition Service programs cost $1.6 billion. That number increased to $82.7 billion in 2010. But over the last 10 years, the total funding for these programs have dropped down to only $193 million. Moving on to the history of the National Institute of Food and Agriculture. NIFA was first seen in the Hatch Act of 1887 as a response by the USDA to support and finance their mission of the land-grant college, funded by the Act to create many agricultural experimental stations and creating a foundation for the Cooperative Extensive Services. The Cooperative Extensive Service was created by the Smith-Lever Act of 1914 and was associated with each of the land-grant institutions. In 1994, the Department of Agriculture Reorganization Act created a singular agency in charge of gathering funds and performing agriculture research. This agency was known as the Cooperative State Research, Education, and Extension Service. This agency was later retitled the National Institute of Food and Agriculture thanks to the Food Conservation and Energy Act of 2008. Next, I will discuss what is NIFA. As previously mentioned, NIFA was created in 2008 as a United States government agency. NIFA provides programs with leadership funding to help advance agriculture-related science research. NIFA also delivers a community-based nutrition education program that assists individuals, families, and communities to make better nutritional choices. NIFA's mission is to invest and advance agricultural research, education, and extensions to solve societal challenges. NIFA does this by working to achieve global food security and to end the fight against hunger, while also taking on the challenge of solving childhood obesity and ensuring that individuals and families in need receive affordable and safe nutritious choices based on scientific evidence. Moving forward to what the Food and Nutrition Service Agency is. The FNS is a service that administrates the country's nutrition assistance programs of the USDA. The FNS goals are to end hunger and obesity, just like NIFA, but the Food and Nutrition Service does this by utilizing 15 nutritional assistance programs, which I will discuss later in this presentation. These services help to address these issues in the United States by providing nutritional support to those in need. The FNS provides families and children with better access to food, whether this is individually, in their schools, or in their communities. According to the Food and Nutrition Service, 1 in 4 Americans will utilize one of their nutrition programs each year. To top it all off, The FNS provides nutrition education to families and children by educating them on proper nutrition and how to properly utilize the nutrition assistance programs to the fullest. The FNS also ensures that their participants know how to make healthier choices. Some examples of this are participants buying more nutrient-dense items in the local grocery store, or by the FNS providing them with simple tips such as to eat more fruits and vegetables rather than chips and candy, and to intake more water rather than sugary beverages. Now I will discuss some of the functions of the Food and Nutrition Service. As I mentioned in the slide prior, the FNS provides nutritional assistance to those in need. The FNS can assist a wide range of ages, from the infant population all the way down to the elderly population. The Food and Nutrition Service works with public, private, and non-for-profit organizations to increase food security and reduce hunger in the United States. They do this by providing low-income children, adults, and the elderly with food in a way that supports the American agriculture by increasing their fresh produce consumption. Lastly, the Food and Nutrition Service is committed to providing nutrition assistant participants with a safe way to access healthy foods in schools for their children and in their local supermarkets, food banks, and food pantries for struggling adults and expecting mothers. The way the National Institution of Food and Agriculture functions is a bit different than the way the FNS functions. NIFA focuses heavily on the research that is done by land-grant universities, the government, and non-for-profit organizations to make new discoveries to assist farmers, classrooms, and communities in need of nutritional or agricultural support. NIFA does this to ensure that communities or struggling areas of the world are able to farm and grow fresh produce to increase their chances of food security while also fighting hunger. By doing this, NIFA is able to assist in obesity prevention as well by increasing fresh produce consumption, as well as ensuring that communities have an affordable and safe way to acquire nutritious foods to feed their families and communities with. Now let's take a look at some of the nutrition assistance programs offered by the Food and Nutrition Service Agency. I will be giving a brief overview of these programs since many of them have already been discussed in presentations prior to mine. The first program is the most well-known program, which is the Supplemental Nutrition Assistance Program, also known as SNAP. SNAP, which is a federal program that helps low-income Americans eat on a regular basis. SNAP also has sub-programs such as SNAP Ed and SNAP Skill, which assist in educating people who are eligible for SNAP on how to make better food choices with a limited budget. This is also used to decrease the rate of obesity in the country, since it is commonly believed that people can only buy less nutritious options with SNAP. Looking at WIC, WIC is similar to SNAP as it provides expecting mothers, their infants, and other children with proper nutritional support. WIC also assists in educating expecting and current mothers on how to properly breastfeed their children and by providing them with nutritious formulas for their children to eat. WIC also provides constant support for the mothers, either by workers there or mothers involved in WIC. WIC also educates the mothers on the proper nutritional recommendations for the children to help them grow and develop properly. Moving on to the child and nutrition care programs, such as the National School Lunch Program and the School Breakfast Program, which allows children who come from struggling low-income homes to receive free or reduced lunch and breakfast to ensure that they can acquire a nutritious meal while they are at school to help them focus and perform the best of their abilities. Programs such as the Summer Food Service Program ensures that children can receive nutritious snacks or meals during the summertime when class is not in session. The Child and Adult Care Food Program provides kids and their parents with nutritional meals as long as the child care facility they're a part of participates in the program. Looking at more FNS programs, the Food Distribution Program on Indian Reservations provides USDA foods to income-eligible households living on Indian reservations, and it provides to Native American households residing in designated areas near reservations or in Oklahoma. While the Commodity Supplemental Food Program works to improve the health of low-income individuals at least the age of 60 years old by providing them with USDA foods. The USDA also provides foods and funds to participating states and Indian tribal organizations to operate the Commodity Supplemental Food Program. Next, the Emergency Food Assistance Programs provides food at no cost to help supplement the diets of needy low-income households. Lastly, the USDA Food in School Program supports domestic nutrition programs and American agriculture producers through purchases of 100% of American-grown and produced foods for use by schools and institutions participating in the National School Lunch Program. Next, I will discuss some of the requirements for some of the key food and nutrition service programs. The first one is SNAP in Illinois. The first requirement is that you have to be a resident of Illinois, have a low household income based on your household size, either be unemployed or homeless, or be the age of 60 or disabled. For WIC, you have to be deemed nutritionally at risk by a healthcare professional, have a low income level, be a pregnant woman or a woman who is postpartum, be a breastfeeding woman, or have an infant and child up to the age of 5. For the National School Lunch Program, the child must come from a household whose income level is at or below the 130% poverty line. They also must be enrolled in a school that offers the National School Lunch Program and must be considered nutritionally at risk. The Emergency Food Assistance Program must meet the household income standard set by the state, demonstrate a nutritional need for food, or be a public or private non-for-profit organization that provides nutrition assistance to low-income Americans. Next, I'm going to look at some of the NIFA nutritional programs. The first program is a Community Food Project Competitive Grant Program, which fights food insecurity by allowing low-income communities to become self-sufficient by allowing them to grow and provide their own food to their communities. The next program is the Expanded Food and Nutrition Education Program. This was the nation's first nutrition education program for low-income populations and still remains at the forefront of nutrition education to today. It utilizes experimental learning approaches that help participants learn how to make more nutritious food choices. The last program is the Regional Nutrition Education and Obesity Prevention Centers of Excellence. This is an interesting program because it is a rare occasion where NIFA and FNS work together with stakeholders to create an effective nutrition education to promote health and prevent and reduce obesity in disadvantaged low-income families and children. Although NIFA primarily focuses on agricultural research, it does play a hand in nutrition education as well. Next, I'll be discussing what is currently going on within FNS. In response to COVID-19, FNS is increasing SNAP benefits across all 50 states for American families by 40%, with the purpose of increasing food security during the COVID-19 pandemic. FNS is also expanding access to online shopping with the purpose of promoting and enforcing social distancing in response to COVID-19. Stores that accept online SNAP payments in 47 states are mainly Amazon and Walmart. FNS is allowing WIC participants to substitute food items for other ones if the item they are looking for is unavailable. As an example, they could purchase an 18 carton of eggs if a 12 carton of eggs is unavailable. FNS is also allowing participants to enroll or re-enroll online to their food nutrition programs to increase social distancing. Lastly, the Disaster Household Distribution is providing boxes to foods and homes in areas affected by COVID-19 to reduce the risk of food insecurity. Now I'll be discussing what is currently going on in NIFA today. NIFA is funding disaster response effort by providing relief to natural disasters through the Cooperative Extensive Programming. NIFA is also investing in rapid response research on COVID-19 and the impacts it's had on agriculture. In April, NIFA announced that it would be investing in research on the impact of COVID-19 and viewing the impact it's had on American agriculture and will invest around $9 million for research in areas such as food and food processing, the well-being of food service providers. NIFA is also seeking COVID-19 research proposal to see the impact it's had on agriculture. NIFA is also granting universities $14 million to find COVID-19 scientific solutions for them. The roles of the dietitian and nutritionist within the food and nutrition service is that they can work for one of the 15 food assistance programs. They can educate low-income Americans who participate in one of these 15 assistant programs. They can advocate for more funding for each FNS program, and they can ensure that new policy changes only benefit the food and nutrition service. Roles for dietitians and nutritionists in the National Institute of Food and Agriculture include participating in research on dietary practices, advocating for more funding for NIFA, being a part of a National Nutritional Committee, which NIFA has to offer, and ensure the new policy changes only benefit NIFA as well. Now it's time for the 3 questions that I have created. The first one is, with so many programs already under the Food Nutrition Service branch and food insecurity remaining as a constant issue, should the FNS create new programs to assist people suffering from food insecurity, or should the FNS continue to invest and expand each program it currently has to assist food insecure people? The second question is if you had the opportunity to pick a food nutrition service program to work for, which one would you pick and why? And how would you advocate for your nutrition assistance program to receive more funding? The third and final question is, with FNS and NIFA both working towards ending food insecurity and hunger in their own unique way, with NIFA using agricultural research and FNS using food assistance programs, which organization do you think is more effective and why? These are my references. And thank you all so much for watching.